Our guests for the next segment have bills involving mothers and babies. First, Democratic Representative Park Cannon of Atlanta. Among her House committees are Ethics, Insurance, and Urban Affairs, and Arts and Entertainment. And Democratic Representative Eric Gisler of Watkinsville. His committee assignments include Defense and Veterans Affairs, Health, and Intragovernmental Coordination. Welcome to Lawmakers again. This is your first time.
It is.
Yeah, because you've been in office how long?
About 3.5 months.
I know, you're just still new. Well, we're going to start with you, Representative Cannon. You have a 36-page bill called the Georgia Maternal Health Momnibus Bill. And before you tell us all about it, kind of explain what HB 925, what led you to do this?
Well, as we all know, Georgia is working to correct the issues related to maternal mortality. But there's still other issues that we have to address. Maternal morbidity, which is a near miss if you almost passed away, or the resources that your child is able to access, or perhaps the education that the providers need to have so they provide better care. So 925 touches all of that.
So what would the bill do? Because you're talking about a lot of different things.
Yes, we went section by section to address a few different things. One of them is to create a pilot program so that there can be telemedicine in rural counties that do not have providers. And that would be great because we have not yet even defined what a maternal care desert is in Georgia. We're trying to define that as a county that does not have a hospital with an OB. And that's a lot of hospitals. In fact, we're realizing that those families not only need telemedicine, but those providers need a little bit of implicit bias training because there are assumptions that they might have made and might need addressed before they actually see somebody who is almost at morbidity when they go to deliver. And lastly, and this is what I love, is we recognize the providers that have been excluded from the perinatal workforce, doulas, and mental health therapists, and lactation consultants. And we pull together a commission that lets those individuals speak more to the state.
And they're in some of these communities that are the deserts you mentioned. Okay, all right, we'll keep up with that one. Representative Gisler, you have a bill dealing with women and babies in a different way, and it's kind of sad. It's a sad aspect of childbirth, but a stillborn baby. And explain the reason behind this bill for you.
Sure, it's House Bill 1422. Shortly after I was sworn in, a constituent reached out to me, and she had gone through a few very difficult pregnancies. And in one of them, she actually had a stillbirth. And she's actually a teacher, so she works for the state of Georgia on the state health benefit plan. And when she had the stillbirth, she was not initially given time off to recover from that because the baby didn't survive, so it wasn't considered a birth. So my bill would add language to add stillbirth specifically as a qualified life event to allow for family leave.
Yeah. What kind of reaction are you getting?
Mostly good, really. There's another representative, Republican representative on the floor that I spoke to about it. She had a similar bill, and it was establishing a 3-week maternal leave time. And so I approached her about it because it really probably made sense to put that stillbirth qualification in her bill. And she liked the language. She was open to it, but her bill had already made it through committee, and she didn't want to amend it and have to go back through again because it was pretty close to crossover day. Her bill did pass out of the House over into the Senate, and I did talk to her a little bit about seeing if we could get it amended in the Senate, but she told me today it doesn't look like the Senate's going to pick it up. So
it's something you're going to continue to fight for, though.
Absolutely.
It sounds like it.
Yeah.
So let's stay with the baby topic and parental leave. I'm sorry. You have you want the state to create a wellness hotline, HB 795. So tell us what that is all about for infants.
Certainly. So any new parent knows how troubling it is when you don't see great signs with your baby. You think that they're laughing and joking, and then are they choking? And so for those moments, parents are holding that in their own. They don't have anyone to go to. And so what we would like to create is an infant resource hotline. And it's particular to a constituent in our district. This is baby Kari. Baby Kari passed away in 2023, very shortly after being born. And sudden infant death syndrome doesn't yet have a really good research basis under it, but it's the understanding that a baby goes to sleep and remains asleep. And when that happened to this family, unfortunately, EMS was not able to help and did not even know how to do newborn CPR. So we want a resource where even that EMS could have called or those parents could have called in.
So a hotline with a number that is easy for everybody to remember, that kind of thing.
We're ready for whatever number Georgia wants to have and whatever community needs.
Okay. We're going to switch a little bit more. You have HB 1382, and you want to ensure that Georgia college students receive credit for military service. So any particular reason for this bill?
Sure, it was another constituent issue. Somebody reached out to me who had spent some time in the military and trained on all types of different things and held different roles in the military. And the American Council on Education actually set standards and guidelines for how to translate military service into college credit. And when I dug into it, I learned that the Technical College System of Georgia, TCSG, actually has a pretty robust program in place to follow those ACE standards, but the USG system doesn't. They do it by policy, but they're not required to by law. So the bill originally just brought the USG under those same standards legally.
The University System of Georgia,
right.
Yes.
And so we reached out to the university system, and they were actually willing to work with us. They actually said, we don't feel like we need to do this because we have the ACE guidelines to fall back on, but what we would like to do is build a database of all the credits that they have awarded people coming out of the military.
Okay.
So that would provide a public place where people could go and see, the University of Georgia has awarded this type of credit for this type of service, and maybe Georgia Tech or another university in the state has awarded another thing. So
you feeling pretty good about this bill too?
Well, I thought so. Yeah, that one actually did get a hearing before crossover day.
It did?
Didn't get a vote. So
okay.
I have to come back again next year.
I know you will. I want to get to something real quick with you. You are not running again. Tell us why.
Well, Donna, it's been 10 years. I have been doing this work in my 20s as the youngest legislator ever. Now I'm in my 30s. I just kind of want to be a young woman in the world, and I won't go too far because there's a lot of progressive politics that still need to be pushed.
Yeah, and so you're still going to be around and talking about the kinds of things you are very passionate about.
Well, listen, there are members like Representative Abel Mabel Thomas, yes, Renita Shannon, other members who have gone on to continue their political work, and I'm looking forward to doing that too.
Yeah, and then how was your first few months? You're feeling pretty good?
I must have liked it pretty well. I signed up to do it again.
Okay.